Well, after a federal agency launched an investigation into McLaren Macomb Hospital following a 7 investigators report, patients and families have been coming forward. They are sharing stories about their experiences inside the hospital. Well, tonight, the children of a Mount Clemens man say they have serious concerns about the case their dad received, the care their dad received at that hospital. 7 investigator Heather Catallo has much more on their story.
Perry Adams died in February after more than 2 months in the hospital.
Just the fact that Dad died suffering, scared, and alone, and maybe didn't need to.
Katie Montry and Craig Adams say they were worried when their dad tested positive for COVID-19. They say he tried fighting the coronavirus for a while at home, but back on December 1st, he was rushed to McLaren Macomb Hospital.
He was such a potent person, he has such a distinct personality, and for him to have been allowed to waste away like that was just appalling,
Perry did have underlying health concerns that can impact COVID-19 outcomes like diabetes, and he was overweight. But his children say they're concerned about an abrupt change in his code status without family approval, an alleged lack of food for their father, and a shortage of communication from the hospital.
I kept asking the nurses over and over, can you have a doctor call us? We want to know about the treatment plan, prognosis, or, how are his lungs looking?
At the start of his hospital stay, Katie and Craig say COVID-19 restrictions were in place, so they could not visit in person to advocate for their dad.
So we did not actually hear from a doctor during that first 3 weeks.
Katie says when she did finally hear from someone, it wasn't his primary doctor.
He said, well, I actually haven't seen your dad. So he had never even laid eyes on my dad yet.
After several weeks, Craig and Katie were finally allowed to visit Perry, and they say they were furious with what they saw and smelled.
He reeked of rot. It smelled like body rot insanely in that room. Made me gag walking in that room.
Craig and Katie say they had to ask that Perry be bathed. And that's not all.
One of the first things I noticed was on his face, from the BiPAP, he had a big open sore on his nose.
But when Katie asked his doctor about that, she says she was surprised at the answer.
I'm worried about it, especially with the diabetes, and she said, what wound?
Katie also says she later found out from nurses that her diabetic father sometimes wasn't eating.
She said, oh, yeah, he skipped a couple meals. Nutrition has just been really backed up. And we were like, so this is actually happening.
Perry's medical records indicate challenges with food in the hospital. In at least 2 notes, the nutrition staff member wrote, awaiting AM food tray still. In another record, nutrition said, no data recorded, have requested staff to record in electronic medical records. By the end of January, records indicate that Perry's malnutrition is significant. But Katie says the biggest shock came on January 31st when a weekend doctor on rounds hung up on her after saying she was putting Perry on end-of-life palliative care, even though Katie says she'd been told he was stable.
I said, can we please wait until tomorrow to get a second opinion? I'd like to talk to his primary doctor that's more familiar with him before we do anything. And she said, no, this decision is out of your hands. And she cut me off and she said, I think you need to process what you're going through, and hung up on me.
Craig happened to be visiting their dad at the time and says he saw the doctor slam the phone down and then turned on him.
And she was in my personal space, adrenaline in her voice. How on earth can you be in somebody's face like that? It was just appalling.
The medical records show that day that Perry's code status changed from full code for all life-saving measures to palliative only. But the next day, they say his primary care doctor gave them a completely different prognosis.
He's not in palliative care. They said, no, we believe that he still has every chance that he had to begin with.
Medical records show one of the doctors who was present the day Perry's code status was changed told the other doctor who talked to the family that he, quote, was not comfortable with the change of code status to comfort care, palliative care. He even asked to have Perry evaluated regarding recovery of his lungs and confirmed with Perry that he did not want a no-code status.
How could that have happened? How could a team of doctors let that happen?
Craig and Katie say they took their concerns to McLaren's chief medical officer, who they say assured them on February 6th that he was looking into everything.
He's like, I just checked on your dad. He's resting comfortably, and I'll keep an eye on him.
But seconds later, Katie says she got a call that Perry had just died.
He died alone, by himself.
Katie says she asked for an internal investigation at McLaren Macomb, but says no one has gotten back to her recently. She also filed complaints with the state of Michigan and the Joint Commission, which does accreditation for McLaren, and both agencies are currently investigating the hospital for allegations about infection control and cleanliness issues. Since the start of the pandemic, the state's Bureau of Community and Health Services has received at least 36 complaints about McLaren Macomb. 27 of those were either closed or referred to a federal or outside agency for further investigation. At least 7 of those complaints were filed after our original investigation aired in May, including one initiated by the Federal Centers for Medicare and Medicaid Services because of our reporting.
I think the hardest thing for us is not knowing if he had been somewhere else, if he might have made it.
McLaren Macomb did release a statement to us from their chief medical officer that says in part, quote, the patient's family declined to sign the release, allowing us to provide details about Mr. Adams' care. However, I can tell you that I personally reviewed the patient file and I can confirm that appropriate medical care was provided. I shared this information with the family back in February. Now, I do want to point out the patient's family did want McLaren to speak to us and potentially to other journalists about their dad's care, but the media release included McLaren's ability to talk about his personal health information on social media. The family asked them to narrow the scope of the language on that media release, but the hospital would not do that. In Mount Clemens, I'm Heather Catallo, 7 Action News.